All right, good morning. We're doing videos this morning. The videos are updates on the latest research. And the idea there is that every day I'm trying to scan for the latest research to tell my patients, follow up with my patients, what are the latest kinds of research publications, and then hopefully with some humility, when I find that there's new stuff, changes in our understandings and research, that I can let my patients know. So for example, we look at vitamins and vitamin deficiencies, and over the years the research has supported a kind of a new frustrating finding, which is that if you have low vitamin levels, it's good to take vitamins to bring them up to normal. We also know that it seems that a lot of studies show that if you have more vitamins in your bloodstream, you have a better overall measure of health, and that can be measured by survival time, cancer risk, heart attack, things like that. So people with higher blood levels of vitamin C, beta carotene, vitamin A, vitamin E, seem to have lower risks of cancer. And we'll talk about some of those findings this morning in some brand new research. But recent research has suggested that if you give people extra tablets of vitamins, higher doses of vitamins, you don't get a benefit, and sometimes you actually harm people. So this is kind of complicated, so I'll say it again, and we go into more detail on some of the other videos. But let's say it again. Low vitamins, bad. High vitamins in your blood, good. Giving tablets of vitamins in controlled prospective randomized trials may actually be hurtful and doesn't help. So based on that initial assumptions, I used to recommend high doses of vitamins to my patients, right? The 3 tablets of the multivitamins. I used to tell everybody that, and it's still in there. But this recent research suggests that we may not get the benefits we were hoping for from that higher dose of vitamins. How can we explain this kind of complex association? It may be that the vitamin level itself is not the predictor of good health. That people who have high beta carotene in their blood have eaten a lot of fresh fruits and vegetables. And it may be, in fact I think it's pretty clear now, that just taking a vitamin A tablet, it doesn't help and may actually increase your rate of hip fractures. Whereas eating lots of carrots and fresh green healthy foods that have beta carotene in it, which is what we think now that blood level is telling us, is good for you. Anyways, this is all new research. There's more detail on this topic, and we're going to go through a recent article in Reader's Digest which kind of simplifies and summarizes this stuff for you to make it easier to digest and understand. No pun intended. And so we're going to go through some of those topics this morning. And the idea is that if you keep track of my videos, either on YouTube or Twitter or Facebook, you'll get the latest scoop. So follow me on Twitter, friend me on Facebook, or subscribe to the YouTube videos. That's what this whole introduction was designed to say. So we'll have a video of